1 tracheostomy clean and care tray. 2 suction catheter kit, and you may decide you want an extra set of sterile gloves. I grabbed one in case my gloves rip or something. I'll often do that when I'm going to do a sterile procedure, have an extra set. I'm going to start with suctioning because to me that makes the most sense. Don't want to do a bunch of trach care, get clean dressing and clean ties on, and then the person is then suctioned and there's mucus all over my clean stuff. So I'm going to start with suctioning. Gather my equipment, enter the room and perform hand hygiene, and then address the patient. Explain the procedure. So, hello there, Mr. Smith. I can hear that you're coughing from the hallway, and I know you've been having a lot of challenges with airway secretion, so I'm going to suction out your tracheostomy tube right now. Is that all right with you? Okay, good plan. Let's get the client in position by raising the bed for me and head up. The person's going to have an easier time coughing and clearing. Their head of bed needs to be elevated for the suctioning procedure. You would want to do this when they're laying flat. I would say at least 45 degrees for this. And I'm going to also anticipate potential for a mess. I'm going to put down a drape over the chest or a towel, just like this, in case there's any coughing. I might also consider, I'm not sure if this is on the checklist, but wearing some PPE for myself so that I don't get blasted in the face. Maybe it could be blood. I mean, you would almost always assume blood. If you took a big mucus blast in the eyes, it'd be nasty. So this would be an appropriate time to put on a face shield. And then I want to assess you. Specifically, I'm going to check your SpO2. I'm going to leave this on through the whole procedure. Put this on your finger here. Looks like we're seeing sats of 90%, a little low. I wonder if that's because of mucus in the airways. We can clear that out and make that better. And then I want to take a listen to your lungs quickly. Take a deep breath for me. Oh yeah, lots of rhonchi on the left, lots of rhonchi on the right. So we're going to suction that out and hopefully make that a little bit more clear for you. Okay, you can see the trach mask system. This is not attached to the tracheostomy tube. This is just applying a little bit of oxygen, humidified air, and some systems will actually warm it for you. This one doesn't have a warmer on it, but you'll see machines that can warm it as well. And so I'm going to leave that over, and actually what I'm going to do is increase the amount of oxygen you're getting to as high as I can go while I'm getting set up. Hyperoxygenate. Just crank this up. Okay, and it's kind of noisy, so I'm going to turn it down, but I would just put that to the maximum of 15 liters. So I'm hyperoxygenating the patient. I've assessed the patient. Let's prepare my goods. So, suction kit. Have yourself a clean, open table with nothing on it. Oh, thank you. Bottle of saline.
So in this scenario, you've already cleaned the table off, right?
Yeah. Is that on the checklist? Probably. Open your kit carefully. Be mindful of packaging that wants to fold back in on itself. Open these things up all the way. I can reach in and carefully remove my sterile gloves, set those to the side. Another thing I can do is reach in and grab my cup. Outside is not sterile. Inside is sterile, so don't stick your finger in there. You're going to carefully put some saline into your cup.
And you can do that ungloved.
And you can do this ungloved, as long as you don't swirl your fingers around in it. All right? Now, the catheter is sterile, and it's inside a separate set of packaging. So before I go in and grab that, I'm going to need to put on my sterile gloves. anytime I'm doing a sterile procedure, I'm just gonna run through a double check in my mind. Have I done everything that I need to do first? Because once I put the gloves on, I can't touch anything else. My suction needs to be set up. So let's come over here and make sure it's working. You wanna put this to regular. You don't wanna do intermittent. If you do intermittent, it's gonna stop suctioning on you at random times. So you wanna do continuous suction, so reg. And then right now I'm at the red. This is too much. I'm gonna turn this down. Oh boy. All right, that is on the yellow. Someone has obviously just screwed that down, and I'm not gonna spend a bunch of time trying to fix it. 80 to 120. 80 to 120. Suction is working. 80 to 120 millimeters per mercury on the wall mount. That's the yellow Goldilocks zone. Not too much, not too little. Now you're gonna need to be able to reach this when you do, after you put your sterile gloves on. So you need to bring this up close by. You can kind of wedge it on the pillow. You can, I don't know, loop it around the patient's neck. It just needs to be close by so that you can reach and grab this once you get your sterile gloves on, okay? Suction's working, hyperoxygenated, got my supplies set up. I'm gonna put my gloves on now. Being very careful not to open my gloves into my sterile supplies. Also making sure that the glove packaging is all the way open and it's not going to fold back in on itself. Pinch. Find the thumb. Thumb's over here. Scoop. They fold over like this, it's a little tough. You touch the inside of the glove with your bare hand. You can't touch the inside of the glove with the sterile hand, so get your thumb out of the way. Scooped on. I can help myself a little bit here, but be careful when bringing that cuff down that you don't contaminate. Sterile gloves are on. Now, I'm gonna take my suction kit out of the packaging. This thing is long and dangly. You want to manage it in a way that it's not going to flop around and get contaminated. You'll see a lot of nurses will kind of wrap it around their fingers like this. I find that to be a little bit awkward. I usually just kind of do a pinch. Just don't want that tip to become contaminated, right? And I'm about to attach the suction tubing. Once I do that, this is no longer sterile. So hopefully I set up properly. This goes in carefully. Keep your dominant hand sterile. I'm connected. This is continually suctioning through, but to actually apply the suction to the patient, you have to cover the hole with your thumb. You hear that? So it's suctioning when the thumb is over the hole. When the thumb is not over the hole, it's not suctioning.
And that part doesn't need to be sterile, the green part?
Nope,
okay.
That's not going into the patient.
Yeah.
This is going to the patient. I'm gonna be very mindful of this, keeping this clean, keeping it sterile. I'm also gonna come over here and lubricate the tip with saline. And this is a good time to test and make sure the suctioning is working. You should hear the water going through and feel it. You don't wanna put it in and realize the suction is very weak or not working, okay? So I'm lubricated, my suction is working. I'm gonna keep this very clean out here like this. This is where some nurses like to wrap it up in their fingers. I find this to be a little awkward, but as long as you're keeping this clear, and I'm gonna instruct the patient on what we're gonna do. So Mr. Smith, I'm gonna be inserting the suction catheter into your trach. It's gonna make you cough real big, and then I'm gonna suck the mucus out, okay? bring the oxygen source down, but keep it close by so that you can reapply it between attempts. You don't want to put it over there and then not be able to reach it. All right? That shouldn't really be coming out. The inner cannula is a little loose. I'm ready to apply suction here. Not suctioning on the way in. In we go, Mr. Smith.
And here the patient will be coughing.
Perhaps not until I hit the carina, which is different on different sized people, but for most people it's somewhere around 15 to 20 centimeters, which you can see marked on the catheter kit. I feel that resistance, and you know what's going to happen is that actually we just take that and just get rid of it. Just get rid of it. Yep, we're going to say that the inner cannula is not present for this demonstration. All right, so I'm inserting. Here we go, Mr. Smith. In we go. Meeting resistance, and as I'm pulling back, I'm not doing continuous suctioning, okay? So here my thumb tip, 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 tip. I'm getting little breaks in the suctioning, and I'm pulling this out, and I'm keeping the entire time to be less than 15 seconds that I was including their airway. And keeping this clean in case I want to do another pass. This is not a sterile hand. I'm going to reapply the oxygen and say, Mr. Smith, just catch your breath, and I think we need to do another pass. There's quite a bit of stuff in there that we're going to suction out. And you're going to do 2 passes for your demonstration. I can see on his SpO2 monitor, he's at 94%, so we're okay. It's not getting worse. All right, let's go for another attempt. In we go, Mr. Smith. If you can, take a big deep breath. In. Resistance. You can twist if you'd like. You don't have to. I recommend against doing this maneuver. Some people do the helicopter. This is just irritating and traumatic and not gonna, twisting the catheter might actually improve with clearance, but be gentle. 15 seconds, no more than 15 seconds. I've noticed that there's some thick stuff stuck in here. So let's do this. I'm gonna reapply your oxygen and come over to my saline and clear the mucus out of the tubing so that it's nice and clear. And maybe I might decide I want to do one more pass. How are you doing there, Mr. Smith? Can you nod your head yes for me if you're doing okay? Okay, he's doing okay. You know, your stats are 100% now. I think we got all of it. So let's be done with the procedure. This is dirty. It's got mucus and crud all over it, and it tends to want to like fling at people. So be very careful. In fact, what I'd recommend that you do is take the tip, wrap it up into your glove, and just dispose of it so that you don't trebuchet mucus blobs at people. Okay? Sats are looking good there, Mr. Smith. I don't need you to be on so much oxygen. I'm going to turn that down. I'm also really curious to hear your lung sounds. I'm going to reassess. Can you take a big deep breath for me? Ooh, should do that through the towel. Great. Oh yes, much more clear. You're feeling better. Wonderful. All right. Turn off the suction. It's noisy. And this is where you could document the care that you provided. And you're done with the suctioning portion of the skill. Okay?